love it. The calls.
You'll eventually get the 20% back. That Silver Connect card is going to pay her co-payments. Remicade, I believe, is an injectable, and her hospitalization co-payments. And tell them to turn his Part B on. Okay, so Christopher Mele, literally up from the bootstraps, self-made, couldn't be more proud of the guy. He worked with one of the larger carriers, saw an opportunity, calls me up, says, what do you think? I said, go for it. You know, with your intelligence, your youth, he couldn't be happier. Access Health is the largest enrollment in the country, in our tiny little state of Connecticut, outpacing everybody. Oh, they're trying to call back in. All right, I will take that call. Michael Regan, how can I help you?
Sorry to interrupt you when you're guest.
No, you're not. You're the client. The show is geared toward you. How can I help you?
Well, I'm hoping you can correct some things for us.
Sure.
My understanding is that people are going to be very surprised, possibly, if they don't take the Platinum plan, because at least the Silver plan is not going to have as many hospitals, doctors, and service providers available to them. My understanding, and I hope you can correct it, Mike, or perhaps your guest, that the lower price plans will not have, for instance, the top hospitals for cancer and for other things that are usually on the higher price plans. If you wish, I probably should hang up.
No, stay on hold, because this is a brilliant question. I did see the article about Memorial Sloan Kettering in the Republican American, but there isn't a Platinum plan being offered here in the state of Connecticut. Let me turn this over to the guru, Christopher Mele, who works for Access Health CT. Christopher.
Yeah, thank you, Mike.
My pleasure. And to the caller.
This is a great question. With regard to the different metal levels and how they relate to the benefits and what's being offered to you, the way the networks work, the networks are succinct across all the different metal levels. The only difference between the metal levels is what we call the actuarial value. The actuarial value refers to the cost sharing between the consumer and the insurance company. So, for instance, a 70-30 cost share or an 80-20 cost share. So when you're talking about the disparities between the Platinum plan and the Gold plan and possibly the Silver plan, typically the biggest difference between those plans is going to be your cost share for hospital services, emergency room services, what your copay is going to be, your prescription drugs, your Tier 1 generic drugs, Tier 2 brand drugs. If there's a deductible before you pay your copay on the brand drugs, it typically doesn't change the network. As of right now, for instance, one of our larger carriers, Anthem Blue Cross Blue Shield, they have what they call a Pathway X network. The Pathway X network is succinct across all the different exchange plans, whether it be gold or silver or bronze. The only difference between the plans is actually the benefits and the out-of-pocket cost for the consumer.
Beautifully put. And remember, each plan has a maximum out-of-pocket for the individual.
Correct.
As well as the family.
And those are preset out-of-pockets set by the federal government that we abide to.
Right.
And as Mike said, right now we don't have a Platinum plan. The reason for that is that we wanted to find plans that we can set up with the right actuarial values from the perspective of getting the right amount of premium. We didn't want to put a plan in place that had a high premium, such a high premium that no one would be able to buy it and it wouldn't be advantageous for them to purchase it.
Let me just interrupt if I could. Let me just get this straight. None of the plans in Connecticut, we're talking about Connecticut, which makes sense.
Our state.
Yes. Would restrict the hospital you could attend. Like if you had a specific heart problem and you want to go to a top heart hospital like the Cleveland Clinic or something, it wouldn't matter which plan you have. Is that correct?
No. What I'm saying is it doesn't matter based on the metal level. So, for instance, what I'm talking about is if you have an Anthem Bronze plan.
Right.
And you wanted to go see a particular provider outside of the network in another state or so on, if it's restricting you from doing that, it would also restrict you across the different metal levels with Anthem. So if one Anthem plan is going to restrict you, then they're all going to restrict you. Specifically about each network, you'd have to actually look at the network and compare it to the hospital you're looking for. But for instance, with Anthem, if you had a bronze plan and it didn't take a particular provider, Well, someone down the street from you who had a gold plan, who has a better plan from a cost-sharing perspective, would still have the same issue of that provider providing coverage for him.
Okay,
Now,
very, very well put. So the problem then simply would be is that the patient would have to look at the any plan and see if there's any restrictions or limited access to some hospitals, but that would have nothing to do with the plan.
With the metal level.
Correct.
Metal level, yes.
So the best thing
You got it.
So the best thing you can do is go see a broker like Michael Regan. No, seriously, go see a broker who's a professional and knows what they're doing. And what they're going to do is they're not going to compare the different metal levels and different actuarial values. For this type of situation, what they would do is compare the different carriers and also be able to compare off-exchange options. I know a broker like Michael he's appointed with every carrier that does health insurance. He knows everybody, so he can go and shop the market and make sure he can find an insurance carrier that can provide the right network for you.
Excellent. Thank you, gentlemen. I think you probably answered not just my question, but for some concerns that other people have.
Without
Thank
a doubt.
you.
In your particular instance, the Cleveland Clinic would require a very good point-of-service plan, or preferably a PPO, which stands for Preferred Provider Organization. So therefore, you, the Connecticut resident, can go to Cleveland Blue Cross Blue Shield and have that covered in network. The minimum upfront deductible on a point-of-service plan is at least $2,000 out of network, and it runs quite costly. So if the Cleveland Clinic is your interest, or Memorial Sloan for my cancer people, you're going to need to buy the better plans, maybe off exchange. PPOs are really going away, and your employer is the best option. The employers will still be able to purchase a PPO.
Well, I just use that as an example.
Right. No, it was an excellent example because people are asking me that now. Well, I bought the gold CDDK. What can I do? Well, you bought the best plan.
Right.
It doesn't necessarily mean you're going to get better Pathway X doctors. The Pathway X network in this particular case, or Connecticut's, or whomever, the networks are the exchange networks. You can get a traditional network, but that's off exchange. Yes, Chris.
And one more thing, too.
Stay on hold.
One more thing about the networks. With the Affordable Care Act, one of the statutes they put in there, one of the requirements for the exchange is that we have what we call a network adequacy requirement. So the exchange actually has to keep an 80% network adequacy. So what that means is, for instance, if you're talking about, if someone has a wife who needs an OBGYN, if you have a chiropractor, or you have a ENT doctor or a specialist, for each of those specialties, or an oncologist, each of those specialties, we have to keep an 80%
board certified.
Yeah, we have to keep an 80% adequacy in those different specialties.
Right.
So to be in compliance, and the carriers have to work with us to keep that requirement up. So if we have providers that go out of the network, we have a requirement to work with the carriers to keep that adequacy. Right. So that's something we do to protect the consumers as well.
Okay, thank you again.
Hey, God bless. Have a great afternoon.